Let's talk about how to build muscle and strength during pregnancy. Really, the basic principles apply for everyone to build muscle and strength. This goes for regardless if you're male, female, your age, whether or not you're pregnant. The basic principles really do apply. So you'll follow my reps framework, but just with some specific modifications for pregnancy. So the reps framework is to help you eliminate confusion and guide you on structuring a routine that has the most impactful elements necessary to build muscle and strength. Again, we just want to modify a couple things to make it work during pregnancy. So let's go through this in case you're not familiar with this framework. Number one is the R. R stands for repetitions. As I alluded to earlier, you have a lot of options when it comes to how heavy you can lift to build muscle and strength. However, lifting too light, which is what a lot of women default to during pregnancy, won't result in much change. The literature indicates that you can build similar amounts of muscle with heavy weights and fewer reps, so let's say 6 reps with really heavy weights, as you can with lighter weights and higher reps. So let's say you're doing 25 reps with lighter weights. As long as you are approaching muscular failure in less than 30 reps, you are lifting heavy enough to build muscle. So for context, let's take a chest press. I can do about 15 reps with 30-pound dumbbells in each hand. I could go heavier and do fewer reps, maybe get 8 reps with 35s. Or I could go lighter and do more reps. Maybe I use 20 pounds and do 25 reps. But 10 pounds may be too light for me. I may go far beyond that 30 rep threshold and therefore not be stimulating much muscle growth or strength. So there's an upper limit. If you're questioning if you're lifting heavy enough, try to do more than 30 reps. If you can do more than 30 reps, it's too light even during pregnancy. You also need to approach failure in each set. And this is something that women get afraid of during pregnancy, but you absolutely can continue to train close to failure as long as you're choosing wise exercise selection, which I'll talk about here in a moment. You don't have to get all the way to failure, meaning failure means you can't physically perform another rep no matter how hard you're trying, but you do need to get a few reps shy. You know you're close to failure when your rep speed slows down, when you feel like you almost get stuck halfway through the movement, and when you have a sudden spike in your heart rate. The burn and overall fatigue are not reliable gauges of intensity, so don't stop an exercise just because it burns. In fact, the discomfort of the burn often distracts people from getting close to failure, and so they stop before they reach those highly stimulating reps at the very end. If that's happening to you, go heavier and make sure that you're stopping an exercise because you are truly slowing down, not because you're bored or it burns or you're overall fatigued. Again, you can train close to failure during pregnancy. If you were lifting heavy prior to pregnancy, you may be able to continue with that. If you are newer to lifting, you may start with higher repetitions and lighter weights. So maybe in that 15 to 30 range instead of going really heavy for low reps, but still try to approach muscular failure. In the Evlo prenatal program, we're typically doing around 15 or more reps, but know that you can always adapt that by doing more reps or less reps, depending on kind of how you're feeling and your fitness levels and what you're comfortable with. So that's the R in the reps framework. Next is E. E stands for exercise selection. This is always important regardless of your pregnancy status, but it's particularly important during pregnancy. This is because, as I alluded to earlier, relaxin increases during pregnancy, making you more flexible, but it can make you less stable, especially when you're weightlifting. The risk is that you can injure yourself by loading deeper joint positions or unstable joint positions. However, there are ways to continue loading your muscles while keeping your joints safe. First is to choose exercises with multiple support surfaces. So think using a wall in your hand or leaning against a wall or laying on the ground or laying on a stool or using a ball underneath you, using lots of support objects so that your body increases stability. I recommend this for everyone because what's cool is when you have greater stability in your body senses it's in a more safe environment. So this means that you're at a lower risk of injury, but the muscle is still getting high stimulus. This is especially helpful during pregnancy because of the increased joint laxity. And you also may have decreased what's called proprioception. So your ability to kind of sense your body in space. So using lots of ground and wall and prop support can be really, really helpful during pregnancy. For example, a ball wall sit is an excellent quad exercise during pregnancy. This is where think of having a ball behind your back, like a small Pilates ball. You can even use one of those big exercise balls behind your back. You can hold weights on your thighs or one across your thighs or one across your chest and slide up and down the wall. And the reason this is really great during pregnancy is because it limits load to the spine. You get really stable. You have lots of points of contact, 2 points of contact with your feet on the floor, and then you've got the point of contact with between your spine and the wall. And this is great because it limits load to the spine while really effectively loading the quads. It's also great if you're someone that experiences any kind of pelvic or low back pain during pregnancy. I'm not saying it's solving your back pain or your pelvic pain, but it allows you to continue to work your muscles around any pain without making your pain worse. In that exercise, another example for the glutes is a B stance lunge using both a chair and a wall. This was one of my favorite glute exercises during my first pregnancy. So you stagger your stance with one foot slightly behind the other, hold a weight in one hand, and then lean against a wall with the other. You sit back into a chair so you have the chair stopping you from going too deep, and then push off the front foot to stand. Again, lots of support with the chair, 2 feet on the ground. You've got the wall, you've got the chair behind you. So there's a lot of external stability so you can really focus on load to the glutes. I have tons of examples on my Instagram. I have a saved highlight called Pregnancy Number 2 Workouts where you can see more examples if you're curious. You can also join the Evlo membership and do the Evlo prenatal program that I taught in my first pregnancy, or just even use machines at the gym. Aside from the exercises you're choosing, how you are doing them is important. Your form may change during pregnancy. Again, you have increased range of motion availability. You potentially have decreased proprioception, so your awareness may be kind of off. So filming yourself can be very helpful. You may also consider limiting how deeply you sink into postures, especially hinge movements like lunges and squats and things like that. So only go through the range of motion in which you can control and connect to your muscles. Breathing is also crucial during pregnancy and applies to kind of exercises and how we're doing exercises. We want to avoid bearing down or pushing down during lifting, almost like you're trying to go to the bathroom. This can put excessive pressure on the pelvic floor. So when you lift, breathe out through pursed lips and imagine your lower belly lifting up. If you struggle to coordinate this or if you're unsure, I do recommend seeing a pelvic floor PT who can do an internal exam and feel if you're coordinating your pelvic floor correctly. Especially if you're having symptoms like heaviness or that feeling like a tampon's falling out or having any pelvic pain, I highly recommend going to see a pelvic floor PT. What about laying flat on your back or doing exercises in a supine position? Are you allowed to do that? Is it safe during pregnancy? Let's talk about it. Many pregnant women can safely exercise on their backs for short periods. Pass it by your doctor and also monitor for any symptoms of dizziness, lightheadedness, sudden increases in heart rate. And if you experience any of those, take an inclined variation with your trunk slightly inclined up or choose a different exercise where you're seated, side lying, or upright. We have lots of options in the Evlo prenatal program that walks you through that in the second trimester and third trimester foundation classes that you'll take when you're joined. So you'll feel like you really have your hands held there. So in short, most women can safely exercise on their backs during pregnancy, but again, pass it by your doctor and monitor for those symptoms. What about abdominal work? This is another fear that women have, is working their abs during pregnancy. Abdominal work is generally beneficial and safe during pregnancy. You can continue to do crunches, planks, and most any abdominal exercise as long as it's comfortable. It's not shown to be harmful for the baby. The caveat is that you want to maintain your intra-abdominal pressure. So watch for coning or doming, which is a bulge down the midline of your abdomen. If you're seeing that occurring, try your pursed lip breath. So modify the exercise or maybe even hold some isometrics. Again, these are things that we walk you through in the membership, and there are pelvic floor educational videos inside the membership if you need more info. I think this is something that women are very afraid of, and it's truly nothing to be afraid of. Highly recommend going to watch the pelvic floor workshops, and they'll really help lift your fear around that. I did one with Dr. Amelia, who is a pelvic floor physical therapist, and she did a ton of education about coning and doming. So that's inside the Evlo prenatal membership. What are contraindications during pregnancy? What exercises should you avoid? So laying on your stomach after second trimester is generally the only kind of strict no-no during pregnancy when it comes to exercise selection. Most everything else can be done with discretion, modifications, and proper breathing. All right, so that's exercise selection. That's the heftiest one when it comes to pregnancy out of these four. The next is P. P is for protein. Just like I recommend high protein diet before pregnancy, I also recommend it during pregnancy. Our registered dietitians that we work with recommend eating between 0.75 and 1 gram of protein per pre-pregnancy body weight throughout the duration of pregnancy. And finally, we made it to S, which stands for structure. This is a piece that many women struggle with because they bounce around between lots of different methods and fitness modalities, thinking that you're getting the benefits from all of these methods, when in reality, many times it's distracting you from achieving any one goal and potentially overusing your body, creating unnecessary fatigue and negatively influencing your recovery. So having a structured routine where you are working each muscle group 2-ish times per week on non-consecutive days is very important. You want about 48 hours of recovery between muscle groups. So if you work glutes on Tuesday, wait until Thursday at the earliest to work the glutes again. I recommend taking 2 days off resistance training each week. These are your active recovery days where you're getting in your cardio. This is where I'll do my longer walks or my hikes, and I'll kind of chip away at my 150 minutes of light to moderate intensity cardio that is recommended for everyone, but is especially recommended during pregnancy. So that's the basics that will build muscle or strength during pregnancy. Just to quickly summarize, the REPS framework, the R stands for repetitions, getting close to failure in 30 reps or less. The E stands for exercise selection, choosing really stable exercises, breathing correctly, modifying if you need to. The P stands for protein, eating 0.75 to 1 gram of protein per pre-pregnancy body weight. And the S stands for structure, working each muscle group about 2 times per week on non-consecutive days and taking 2 days off lifting where you get in your light to moderate intensity cardio.